is a homegrown vision.
Hi, welcome to the Chronicles of an African Diaspora Nurse. Thank you so much for tuning in once again. If you're new to this channel, it's all about giving back to Africa in the areas of healthcare and education. And of course, I also do some random vlogs. So tonight, I am particularly excited about the conversation that I'm about to have with the CEO of a newly opened ultra-modern healthcare facility, which is located at Asuoyeboah, a suburb of Kumasi in the Ashanti region of Ghana. So let's welcome Dr. Kwabena Achamfour Ababio. You're welcome to the channel.
Thank you very much.
Okay.
Thank you.
So just introduce yourself to us, know who you are. I know you are the CEO, but tell us a bit about yourself.
I am Kwabena Achamfour Ababio. I'm a medical doctor in Ghana. I completed school in Ghana. I have a diploma in anesthesia, but my actual specialization is in obstetrics gynecology. And then most recently, we opened up Orion. So I am the one leading affairs here right now.
Yeah, thank you so much. I think in the earlier chat, we're talking about the fact that you trained in Ghana, you've worked in Ghana, and
Yes.
most times when you hear about such modern facilities, and sometimes people think that, oh, there's some help from Abuja or abroad, or have some partners or somebody from abroad has come to build it. But this is locally,
Yeah.
the locally driven vision. Tell us about it, and what's the
Yeah.
vision for the hospital?
So this is a homegrown vision. So the motivation behind this vision or the edifice that you see was that for most of us as African health personnel, the knowledge base and the enthusiasm and the passion for caring for people is there. But sometimes we are limited in our efforts because of certain machinery or, devices, modern wise, that can help us take care of patients very well. So this is a journey. It's been over 6-7 years that everything has been put together all by ourselves. By ourselves, I mean my family, to bring this into light. Yeah, so it's totally a homegrown vision by the grace of God, with no help from external source or funded abroad. We just put together our ideas and then it's come to life.
It's really, really inspiring to hear that. And so tell us about the services that you provide.
Yeah. So basically Orion is one thing you must know is that our motto, okay, is innovative care, trusted expertise. Let me just go into a bit of that we are trying to bring innovative care, innovation in terms of machinery, and also modern ways of treating our patients. That is the predominant meaning of our innovative care. Trusted expertise is that we are bringing to you consultants and specialists in various areas that can treat you to a level of satisfaction. Currently, I'll start from minimum to maybe highest, however you put it. But we offer general care services, what we call a general practitioner or your GP.
Yeah.
We offer that at the baseline. We also offer specialist care. By specialist care, in medicine, we have broadly 4 categories. We have medicine, surgery, obstetrics, gynecology, and then child health. And under these, we have different subspecialties.
Yeah.
So we offer all services in these broad categories 4. Under surgery, however, we offer orthopedics and trauma surgeries. We do neurosurgeries as well. And I said I'm originally an obstetrician gynecologist. Okay. One of the things that sets Orion apart is the fact that we want to integrate services that you might find maybe in the public sector alone because of maybe access. So we have what we call intensive care services. By intensive care, I mean that we have a unit that provides ventilatory support and extensive care for patients who are in critical condition, right? We also have available minimally invasive procedures, what we call laparoscopic or endoscopic surgeries. We provide those surgeries as well. Predominantly, we offer what we call the TURP. I'm talking about it because it's not that popular in private sectors. Recently, the government commissioned a unit like that in Accra. The TURP, like I was saying, is a transurethral resection of the prostate, which is a minimally invasive procedure. What our men have been used to is an open prostatectomy, where you open up fully and have your prostate resected because of prostate issues. It could be a cancer, it could be a benign situation. But we have a minimally invasive procedure that is, less bloody, and recovery period is also very fast. And so we are offering that service here at Orion.
Okay.
One other thing is that we have a full emergency department, and that is on like any private facility. We actually offer a full emergency department here at Orion.
Yeah, I must say that I was really impressed looking at the video and the pictures, which I will show. So, I mean, if you're watching this, wait till the end. I will show some of the pictures. But coming back to the TURP, I know, you and I are medical people. I mean, for the layman, how would you explain it to them? Yeah.
Yeah. So I'm sure that most people have heard about prostate issues.
Yeah.
Yeah, this is for our men, our males. The TAP is nothing, I should say. It's a procedure, basically. It's a surgical procedure. What I mean by minimally invasive is in doing surgeries, we are used to opening you up, cutting you up, with a big scar at the end of the surgery and things. But with the TEP or the TURP, it doesn't involve that. It's a less invasive procedure. We use it to take out the prostate.
Yeah.
When you have issues with it.
Is it like you use something like a camera or probe?
Yeah, we use a camera. So it's a camera-based operation. So we do everything. The surgeon sits, passes his instruments in you, and he operates looking at a screen.
Yeah.
And it's real time. And I was just saying the recovery period is way better than having an open procedure.
Yeah. That's really impressive. I mean, like I said earlier, I mean, looking at the facility and the equipment, it's top notch.
Thank you.
I know that for the people in the diaspora and people who've moved, and not just people in the diaspora, even some people in Ghana, when they are sick, they want to go abroad to have treatment. And likewise, people who've lived here for some time, I think some people, even when they are moving back or thinking of relocating, one of the things that can be a hindrance is access to good quality healthcare.
Yeah.
So to see something like this or to find a place like this is reassuring. What should clients or patients expect when they come to Orion Healthcare or the hospital?
Yeah. So one of the things, I mean, just to build up on what you just said, is that I'll just share a little story. In my 5th year in medical school, I had a chance to have an exchange program at the University of Michigan.
Yeah.
And now I was in 5th year. And somehow my attending at the time, was quite nice. So she made me follow her around.
Mm-hmm.
And during one of the deliveries they had, I was in obstetrics gynecology department.
Yeah.
She asked that I could partake in the delivery. And she was amazed that as a fifth year medical student here in Ghana, the kind of things I was exposed to and what I could do at that delivery. I mean, this is just to build up on the point that most of us as African doctors are really well trained. We just don't have the access to the necessary equipment or modern day equipment to improve upon the already knowledge base. And so if you realize most of the time when we go out there or we come overseas, we excel in the medical sector. And this is not debatable. So at Orion, we are trying to merge this. We are trying to merge this knowledge base with modern day technology or modern day equipment to make first of all, to provide quality health for you, the patient, and to make the doctors work easier. Because, I mean, with that, they get faster results, a better treatment plan for you as well. So that's what you should expect when you come to Orion. You should expect that you meet well-trained nurses, mannered nurses with very excellent customer service who would assist you with any need that you have. In fact, that is something that we pride ourselves with. And I can assure you that the kind of treatment that, we talk about that we receive when we go out there, the kind of health or kind of labs, the kind of investigations you want to do, I assure you that when you come here, we can offer that to you. We can definitely offer that to you.
I couldn't agree with you more, on the first point you raised about having access to the equipment, because as a healthcare professional, whether you're a nurse or doctor, if you work in an environment and you've got the tools to work, it makes the work enjoyable. But then if you don't have it, it's just I don't know.
It's a headache. I mean, it's a headache, and sometimes you are helpless because you know very well that okay, maybe if I had this patient's life would be made easier. I could save this patient's life, but you just don't have it. And so we're trying to bridge that gap here, especially in the private sector, because one thing that we noticed was that, some people will want their privacy, but because of the access to such equipment, which is probably only available in facilities or in the public sector, they end up there or they have to be taken there because the situation has gotten more critical and they have to be transferred. And so what we're trying to provide for you here is a one-stop shop for healthcare. That when you come here, from top to bottom, we can sort you out medically.
Talking about the good quality healthcare, and it comes with affordability. And I know that, in the society, we've got different levels. There are people who can afford everybody's budget. Let me say, everybody's budget is different. We have from low to high. And so when it comes to affordability, I know that in Ghana, there is the National Health Insurance Scheme. And then this is a private hospital. So in terms of affordability, what should people expect? Can somebody on the, somebody who don't have, in quote, can they come, or is it who can afford the care?
No, so what we try to do is to make sure that the access is to everybody. You spoke about the insurance. We do provide private insurance and accept corporate insurances as well. So anybody on private insurance can walk through our doors. But I assure you that with the kind of service you are getting, I don't want to make this a business talk, but you're getting quality healthcare for the kind of money that you're paying for it. For the passion for my family and I was to provide healthcare at very good, and affordable prices for everyone to have access to. And the healthcare is one that me myself, I'll pride myself with the fact that when I am sick, I want to be treated here and nowhere else. I don't want to go anywhere else.
Yeah.
So I think that it's about time that we understood that, if you're getting the kind of equipment that you're seeing and you're getting the kind of service that you're seeing, if you have to pay to, see yourself healthy again,
Yeah.
I think that it's very reasonable. It's very, very reasonable. I just want to put out there now that I've heard so many comments, with people saying from the videos that have gone around that, hey, I mean, for people, especially here in Ghana, saying that I'm sure they charge in dollars and stuff like
Let me tell you, somebody asked me the same thing here. When they saw I did a short, and somebody said,
Okay.
"Oh, they're going to charge in dollars." I said, "Well, I don't know. We'll have to
No,
wait."
no, we are not charging. We cannot do that. That's what I'm
Yeah.
saying, that you'll be amazed to come and find out how much you're paying for the services
Yeah.
that you are receiving, because the focus is to make sure, all right, and to alleviate the government's pressure on our facilities, that we in the private sector can support them in a way, right, to limit, because now if you go to meet some of our emergency services in the public sector, they are overloaded.
Yeah.
Right? They're overloaded. So even the private sector can help do this and then alleviate some of their troubles, it will be good. So please, we are not charging dollars. Our prices are not exorbitant. We are very reasonable people, and we're giving you affordable healthcare. I can assure you of that.
Yeah. Thank you. Thank you so much, Kobe, for that. And I would say that I was researching a bit about what's in the news, and there was an article on Joy Online. I think they came to the opening, and one of the directors from is it Ghana Health Service? I'm just going to
Yes.
read what they said. He said the state of healthcare in Ghana is a shared responsibility. The landscape is a dynamic and evolving one, especially with a growing population and the emergence of complex health challenges. The demand for comprehensive, high-quality healthcare is critical, and the Ghana Health Service has a mandate to ensure that. Goes on to say that we cannot address the increasing health issue alone. It requires collaboration, innovation, and synergy between private stakeholders to achieve universal health coverage. And as you know, I was in the Ministry of Health in Ghana many years ago. I worked with Pudiomon.
Okay.
And moving here, I've continued. I'm still in the health sector, but I do keenly follow what's happening in the health sector in Ghana. And I can say that, yes, access to good quality healthcare cannot be covered only by Ghana Health Service and Ministry of Health.
Yeah.
And private stakeholders, NGOs, everybody coming together to ensure that, the ordinary Ghanaian has access to good quality healthcare. So I believe your facility is going to meet a huge need in the area of healthcare, access to healthcare and healthcare programs.
Definitely.
So what message do you have for those in the diaspora, those people who are a bit skeptical about healthcare in Ghana?
It's all about reassurance for them that now when they come home, they should feel, I have an uncle, who I think somewhere last year, he came to Ghana, he started feeling unwell, and he won't attend any hospital until he got back to the States. Right? Yeah. I mean, and he was in Kumasi, and it was difficult to understand because he felt like he will not get the service that he needs. But the assurance is there. And so we didn't showcase some of the things in the videos to pride ourselves. I mean, we do pride ourselves that we have them.
Of course,
but
you have to.
not to blow our horns in a negative way, but to give you the assurance that when you come, And no matter how critical your case is, we can take care of you.
Mm-hmm.
And you are assured of, very good results, very good diagnosis, and very good treatment thereafter. That is what I want to assure them of. And I mean, we are not going to operate this facility with any substandard or unqualified personnel. We have very good consultants coming on board because they've bought into our idea of providing that kind of healthcare that we are looking for, that kind of treatment that we get outside. And so everything was thought through, every single thing. Orion has invested so much. We have our own oxygen plant that makes oxygen for the facility. And, I'm saying this, it might not be the same for people out there, but in Ghana, it's not that common. But that's just to tell you that you can never be short of oxygen supply.
Yeah.
Right? We have a three-tier um, 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 three-tier levels of power. We have solar, we have a standby generator that powers the whole facility. And then we have ECG, our normal electricity. So you're short of, a 24-hour supply of electricity with no hitches or, you hear that something has gone off or a patient's money. No, you're not going to get that. African doctors are excellent doctors. I tell you. We are so knowledgeable. And our nurses are fantastic. We excel everywhere we go.
Yeah.
So it should tell you that with, available resources, we will do marvelous things. So they should be assured if you're coming home, especially if you're coming to Kumasi, Ashanti region, rest assured that, you can pop up, you can pass through it for wide range of labs we can do for you, whatever checkup you are interested in. Yeah.
Thank you. Thank you so much. The oxygen bed, I nearly forgot I was going to ask you. Because I've heard horror stories before where people have gone to places and then they've passed because there's no oxygen. So this is really interesting. I've never heard of anybody, generating your own oxygen. So that is something. Is this new?
I think that I can say on authority that we are probably the only private facility in Ashanti region offering this, that we can make. We have our own oxygen plant that makes oxygen for the facility. It's not anywhere, unless someone can come and prove me wrong, but I'm quite certain that we are the only private facility offering that. And you don't get that service anywhere. It's because our patients are very important to us, very, very important to us. And so if you need to be on oxygen for 3 months to save your life, we have it available.
It's so reassuring. And I cannot go without talking about human resource, but I think you touched a bit on that you have qualified, well-mannered nurses. So in terms of staffing, how is it? I presume that you are fully staffed, you got well qualified.
Yes, we are.
And
so
customer service, the most important thing.
Very, very important. It's one of the things that, we believe in establishing a culture as an Orion group that as much as, people, you are the one who is healthy now and a patient has come to you, but understand that one day you might be a patient as well. And so you cannot treat anybody less off. You cannot treat anybody the way that you don't want to be treated. And so that is one thing that is from our gate, our security men will meet you, and it will amaze you to find out that even if we just find you wandering around on our facility, anybody it might be annoying, but people will approach you to find out if they can be of help to you. And that is something that we are doing, strictly here to make you feel comfortable. And so for our nurses, for example, we have a wide range. We have critical care nurses, emergency nurses available, okay? And then we have midwives. We have general nurses as well.
Yeah.
who are well trained, well mannered to take care of you. And I assure you, you have a very pleasant experience. We have lab technicians, our lab scientists available as well. We have a sonographer, we have a radiologist on call who would, interpret our results for us. We have a radiographer as well, because we have an X-ray machine here right now. So it's a wholesome. Oh, I even forgot to add that we are offering dental services, right? Dental services are also available to you. So everything was thought about.
That is amazing. And you know what? I'm going to be a bit biased. My
Sure,
specialty is psychiatry, as I see today.
sure. Yes.
Anything on psychiatry?
Yes. We're establishing a mental health clinic, and as
Okay.
well, yeah, and a reproductive health clinic for adolescents as well.
Okay.
So that is there. Eventually, so then, I mean, it's early days yet, but you
Yep.
need to start planning,
Yep.
because we believe in offering wholesome care. So we want to move into diagnostics and full rehabilitation centers for, both, the psychologically and physically challenged. So
Yep.
we are looking at having a diagnostic center and then a rehabilitation garden
Yep.
for our mental health. It's a whole plan ahead. So that has been considered. Trust me.
Yeah. So I can't wait to visit when
Yes, I'll be very
that
happy.
next. Yeah.
I'll be very
So
happy.
if any healthcare professional in the diaspora is coming home and they're thinking, oh, maybe I wish to go to this hospital and volunteer and support them, is that
So I mean,
feasible?
yeah, I mean, we are looking for such collaborations, to be honest. And so for anybody interested in something like that, they could just write to us
Yeah.
or let us know so that we can establish some privileges for them
Okay.
while we are here. I mean, that's something that we are looking forward to, because we want people to come and experience and even share ideas with us
Yeah.
on ways to do things better. And so we are very much open for that.
Thank you. Thank you so much.
Thank you to Auntie Rita.
Kwabena Achamfour Ababio. Thank you for the conversation. I really appreciate your time.
Thank you.
Thank you.
Thank you so much. And thank you for the opportunity.
Yeah. So you've heard it from the horse's mouth. Thank you so much for watching. I hope that the next time you are in Kumasi, you visit this facility for yourself. Till I see you in the next one, take care and bye. And don't forget to subscribe.